Thank you, Premier. So 214 of today's 246 cases are in only 8 local government areas. There are 97 cases in Hume, where 48.2% of people have had their first dose of vaccine. 31 cases in Moreland, where 54.7% of people have had their first dose. 23 cases in Whittlesea, where that number is 49.8%. 17 cases in Wyndham at 58.5%. 15 cases in Hobsons Bay at 61.4%. 13 cases in Darebin at 54%. 11 cases in Brimbank at 51.5%. And 7 cases in Melton at 53.7% first dose. So largely stable in the west of Melbourne in terms of case numbers. We've seen a really significant uptick in the northern suburbs of Melbourne. So it does tell you that the west of Melbourne did what we asked of them a couple of weeks ago. These numbers reflect the change in behaviours, the isolation, quarantine, testing and following the rules. That needs to continue. The threat is still there in the west of Melbourne, and the emergent risks in the north of Melbourne should not be forgotten. Those cases have almost doubled in just 3 days. These vaccination numbers also tell you that there's a way to go. These are largely below the Victorian average for first doses, and so grab those AstraZeneca doses available, or otherwise book in for the appropriate vaccine for you. Because those individuals that the Premier spoke about in ICU, they are unvaccinated or not fully vaccinated individuals. That is almost universally true for those hospitalised. So if you're especially if you're over 60 years of age and you're waiting for a vaccine, please don't. Please get a vaccine that's available for you right now. If you've got concerns about medical conditions, high blood pressure, high cholesterol, if you've had a stroke, if you've got cancer, if you've recovered from cancer, if you're like me and you've had asthma, they are reasons to get vaccinated, not reasons to defer your vaccination. Can't be clearer than that. They are reasons to rush to get your vaccine rather than rushing to get a place in ICU. The transmission that's now, especially in the north, but continues in the west, we're looking at small businesses with strong community links and working with them on how they can protect the community. We know that there are many open and permitted to trade, but that is an opportunity for you to look at again your COVID safe plans and make sure that you're protecting those who are accessing your businesses as much as possible. You've got a responsibility to protect the community that are using your services and your business. That includes for QR code check-in, for wearing a mask and for appropriate social distancing. With respect to outbreaks active at the moment, there are 47 cases linked to Casa Suites in Coolaroo, 21 linked to Classy Kitchens in Craigieburn, 9 linked to Al-Hajj Halal Meats in Glenroy. So if you live in Hume or northern suburbs of Glenroy, I want you to be extra vigilant for symptoms, to absolutely come forward at the first sign of symptoms and get tested and isolate until you've got that result. Be absolutely clear that this virus is serious. It can hit you head on. You can become unwell very quickly. You can require hospitalisation very quickly. So get tested and understand if you're a case, if you need to be linked in with care at the earliest possible time. On the other side of Melbourne, we've got 95 cases linked to Panorama construction site in Box Hill. And also of note, 1 case notified to the department yesterday was a nurse working at a hotel quarantine facility. Alfred Health have taken a very conservative approach to furloughing the close contacts there, and 31 staff from the hotel are currently isolating. The nurse and all of those contacts are in quarantine. There'll be further work to assess the impact, but the hotel is open for business. And investigations are underway into exactly how that infection was acquired, but no known PPE or protocol breaches. Tier 3 PPE worn by all staff, as you'd be aware, in hotel quarantine. On the school blitz yesterday, there were thousands of priority kids in Year 12, and those vaccinations do start today. That's very exciting. There are also Year 11s completing their 3-4 subjects who can also book from tomorrow. And the Blitz is really all about giving Year 12s the opportunity to head into exams. Some may welcome that, some may not, but it is a critical opportunity for them, and we need to make sure that we keep them as safe as we possibly can. On testing, 43,858 tests processed yesterday. Even if you're vaccinated and you've got symptoms, you need to get tested. If you're vaccinated and you've been to exposure sites, you need to get tested. So vaccination absolutely protects you, especially from serious illness, but you can become infected, you can pass it on to others. So you do need to get tested, even as a fully vaccinated individual. If you need support while you're getting tested, there's that $450 payment if you haven't got sick leave available to you. If you need support for whatever reason, please reach out. Go to that departmental website, www.coronavirus.vic.gov.au. We are here to support. There's been an enormous amount of work in community fora and networks, people sharing videos and advice via their WhatsApp connections and on Facebook groups. Please continue to do that. You reaching out to those around you, to those who trust you, and with your ability to share trusted information, that is really critical to get the word out. As the Premier said, it is absolutely a race. We've got the same number today as yesterday, but we're on, unfortunately, a slow but steady increase in numbers. We can turn this around. We will turn this around. It will plateau, but it'll plateau at a time when we've got sufficient vaccination coverage to drive those numbers down. And in the meantime, everything that you do right in terms of social distancing, wearing a mask, getting tested, quarantining, will buy us the time to get to that full vaccination coverage. Thank you.